and never been declared an adult by a court through, for example, the process of legal emancipation. Minors generally don't have a legal capacity to consent to medical treatment, and typically it's parents who provide that consent. In circumstances where a parent is not present, then there are some exceptions to this rule. For example, a family member like a grandparent, an adult sibling, or an adult aunt or uncle may provide that consent for the minor. In other situations, it might be a healthcare provider or the court through, for example, judicial bypass that provides consent. And now I'll pass it off to Arlen, who will take us through a scenario to test our knowledge on minor consent.
Thank you, Kinda. So yes, we're gonna test your knowledge, see what you all know so far through a scenario, and then we'll do a little poll and see what we think. So the scenario goes, Z and D are in a relationship and Z gets pregnant. Z wants to get an abortion, but she doesn't want to tell her parents because she knows they will be against it. D and his parents support her decision and they take her to the abortion clinic. So now we're going to do a poll through Mentimeter. I think the link will be provided in the chat, but it's also going to be in the screen and the code is also in the chat. So yes, we're going to do the Mentimeter in a second. And I'm going to ask you guys 2 questions. Okay, so the first question is, who should provide consent for Z? Is it Z herself, Z's parents, D's parents, the provider, or a judge? So the link is on the chat and it's also in the screen. Oh, you guys are quick. Okay, so far we have Z's parents, the judge. Oh, the link is, oh, you got it? Okay. Okay, most votes are for Z. Let's see. Let's see how this goes. I like that it has like different colors. So far, 6 votes for Z. Are any of y'all having trouble? 7, okay. Okay, Z's parents are coming up. Yes, the link, just to remind y'all, is MENTI.com. I think for now we know, or at least the majority think that Z should provide consent for herself because she's the one that wants to have the abortion. But the next question is, who will ultimately provide consent? So the previous one was who should provide consent, but this one is who actually will have to provide the consent. Okay, so far as these parents, okay. Let's see what other people think. 1 vote for provider, 1 vote for the judge, 2 votes for the provider, 1 vote for Z. Okay. I'll give a few more seconds and then we'll talk about it. It seems like Z's parents is the one with the most votes, but in reality, the person that will actually provide the consent is the judge, which only has 1 vote. The reason for that is the judicial bypass. So in Texas, a minor can get judicial approval to have an abortion without notifying one of her parents or guardian. To do so, a minor must file an application for a court order authorizing her consent. The court may allow the minor's consent if it determines one of the following: that the minor is mature and well informed about her pregnancy options to make a decision without a parent or guardian being notified. Notification would not be in her best interest, or that notification may lead to physical, sexual, or emotional abuse. So I hope that was helpful and understand, at least for this scenario, how it would work out. Now I'm gonna pass it to Sarah.
Okay, we're gonna go over quickly what are like within a minor's rights for consenting to their own medical care. So first off, seeking mental health services. If a minor would like to enroll in an inpatient mental health facility, then the consent lies with them and they are able to enroll themselves. The next one is abortions, which we actually kind of just went over. If a minor would like to receive an abortion without notification to their parents, ultimately the consent does lie with the judge if they go through the judicial process, but they do have that option to have a judge decide on that. Next is prescription contraceptives. Minors are allowed to receive prescription contraceptives without parental consent if they go to a Title X clinic. Treatment for STDs, if a minor is diagnosed with an STD and they would like treatment for that, they are allowed to be the ones to consent for themselves. Next is over-the-counter contraceptives. This includes emergency contraceptives like Plan B or the morning after pill, and minors are allowed to buy those for themselves. And then next is patient confidentiality. So a conversation that a minor has with their physician or their other providers is confidential between them and their provider. So minors should be encouraged to be open and honest with their provider. Next up are more of the limitations on minor rights. This includes receiving immunizations. So if you want to go get a vaccine and you're a minor, you do need your parent or guardian's consent to do that. Next is consent for examinations of abuse or neglect. So if a provider thinks that a minor is being abused or neglected, the consent relies with the provider to do that examination, and the patient or the patient's parents don't need to consent to that. And then lastly is prescribed birth control. In a lot of clinics, you do need parental consent to prescribe birth control, and it's a very specific consent about the type of birth control that's being prescribed and the patient. So if it's not at a Title X clinic, a minor would not be able to just get that for themselves.
Hi, my name is Boomy, and I'm going to be going over how we think as adolescents it would be really helpful to build a healthy like healthcare provider and minor patient relationship. So first, I want to kind of talk a little bit about mental prep, because I am a firm believer that I think that if you can mentally prepare yourself for a conversation, it can go a lot better than what you might originally think it would go. So first, I want to talk about bias. I think that I have noticed this whenever I talk to other healthcare professionals. So this is just an observation that, and just people in general, that the way that maybe a young person should lead their life might have like that outlook might be impacted by how they think they should have lived their life. And we live with all types of biases as well. And I think it's really important that you kind of check that out the door. Just because the way that you may be raised, the way that maybe you think is right, might not be right for your patient. Next thing I want to talk about actually is having an open mind, which goes along with bias. So not just saying, okay, I'm going to leave all my preconceived notions at the door, but also be ready to have an open mind and to hear something that you might not expect. It's really important that you try to keep it as much of a judgment-free zone as possible, because I think that is, at least for me, I know that that really makes me clam up, like in the doctor's office. The next thing that I would really like to talk about is empathy. So this goes along with open mind as well. Are you truly putting yourself in the patient's shoes? And this doesn't always just mean like, oh, well, like I was nice or I was kind, but would you want to be talked to the way that you spoke to the patient? I think there's like actually a very big difference between maybe what we think is kind and how we might want to be treated. And there's a little bit of, there sometimes can be a little bit of a room for misstepping. The last thing I want to talk about in terms of mental prep is patience. And that goes along with everything that I just said. Because whenever you are going to approach a minor, I think that important that you keep in mind that obviously they did not go through all the school that you went through. They did not go through all of the tests that you went through, anything like that. So whenever they may ask you a question, though maybe to you it's like, okay, well, duh, it's A, B, C, D, F, G. It's really important to, like I said, like have an open mind and to make sure that you are being patient and giving them the information that that they may be asking for, because at the same time, with bias and open-mindedness, like if a minor wants to do something, they don't actually need your permission to do it. If they want to go and get pregnant or anything like that, when it comes to family planning, like if they really want to do it, they will do it. So it's really important that you, as the healthcare professional, provide them with all the information that they might need, instead of maybe having a bias and judging them, maybe even if it's implicit. I think that checking that at the door is really important. The next slide is going to be talking about ways you can improve the relationship while you are in the doctor's office. So the first thing I want to talk about is one-on-one patient interaction. I think this is really important. I know that for me, with my doctor, it was really helpful because it actually forced me to have a conversation with my doctor, which I wasn't used to. And I think it also it allowed me to really think for myself instead of like kind of depending on the parent in the room. I think it also makes the minor feel a little bit more comfortable, even if it is kind of awkward at first. It ultimately makes the minor patient, I think, a lot more comfortable, because there might be things that they might not want to say when their parent is around. Next thing is confidentiality. I think that it's really important in any kind of relationship at all, that there's a factor of trust. So making sure that, and this comes in with empathy and patience as well, is that you establish right from the get-go that whatever they have to say is kept between you and them, unless it is like something that can cause harm to someone else or themselves. I think that if you can establish that at the get-go, your patient is going to be a lot more forthcoming with questions. The next thing is being ready to educate, which goes along with patience, right? So make sure that you are ready to answer maybe questions that you maybe had not thought of before. And I think that goes along with empathy too, that maybe think they may ask you a question that you had never thought of, even whenever you were their age, and be ready for that, because I think I've done that before with my doctor too. The last thing I want to talk about is active listening. So active listening obviously means that you are not thinking of what you want to say as someone is speaking. I think that is really, really, really important. To truly understand someone, you have to actively listen to them and not immediately think of how you want to respond when they're telling you their side of the story, in any case, especially when it comes to something like this, because this whole thing, the health provider has to kind of facilitate this very trustworthy environment. And so if they feel like you are not listening to them, that is another way that they may not be forthcoming with information that you can then help them to plan and things like that. So that's my slide. I'm going to be handing it over to Michelle.
Thank you. So this topic that we will be talking about is how guardians can educate their child. And so the next one is ways to educate. So the first one is defining healthcare in terms of what your child can understand. You know your child best, so you're able to define healthcare in a way they can fully grasp that word itself. So yeah, so then for the second one, it's to define consent and who is responsible. So it is important to define consent to your adolescent and educating them on who can give consent on their behalf and also your behalf. You can mention who can step in with a verbal or written consent, as like we've spoken about earlier, when you're not around for your adolescent. So it could be your grandparents, adult sibling, or adult aunt and uncle that they have. And yeah, it's just really important for them to know that the adult figure that they have there with them, whether it's you, the legal guardian, or someone else that you've given consent to, that they are fully aware that this person has permission as well. And then for the third one, it's to leave the room. There's a lot of trust between a doctor and a patient, and guardians should try to step out of the room in order for the child to feel comfortable to share something confidential with the doctor. You don't want to hover over your child, and you want to give your child that safe space that they need between them and their healthcare provider. As for the fourth way of educating is to set a good example. You need to show your child how important it is to go get checkups or vaccinations by bringing them along and always asking questions actively at these appointments. You can also have the healthcare provider define terms that might be unclear to you, and that could further educate them as they're listening in on the conversation. And adolescents learn through observation. So by seeing an adult figure take the lead in these situations, it can influence them to follow in the same steps that you have. And so, yeah, these are kind of just 4 ways of educating your adolescents. And we can now move on to our Q&A. So yes, you can follow the link, I believe should be in the chat, and type in the code as well. And just send in any questions that you have and we can go through them together.
I'm curious. Hi, Selena Nance. I'm the early childhood program manager at People's Community Clinic. I'm curious, just having a daughter and not quite that at that point yet where she will be a tween or an adolescent, but eventually she will. I'm curious as to what advice you have as adolescents and young adults on how you would want your parents to talk to you about sort of your medical visit. Like, I think it's good that parents inform their kids and, we can tell them to empower them to talk to their doctors, but some parents aren't always so comfortable with that conversation. So what advice do you have, or what suggestion would you have for a parent who's maybe a little bit weary to have that discussion or even open that box with their kid, and sort of empowering them, especially when it starts to get to that point where you're having a puberty talk or a contraceptive talk. Yeah, curious to hear y'all's thoughts.
I think I have an example. I have a brother who's 9 years younger than me, and because my parents don't speak English that well, I'm the one educating him at home. And he's a very shy boy, and I feel like he hasn't really gotten to the puberty. He's 11 right now, or 12. He's 12. He hasn't really dived into puberty just yet. So we're kind of at like the cusp or borderline, as you can say. And the ways that I kind of educate him are just bringing up words. So I could be like, Anthony, what does this word mean? And he's like, oh, I think it's this. And then I'm like, okay, like you're on the right track. And if there's anything wrong in what he says, definitely encourage it and correct it is what I usually do. And just that's further like educating him on what the word is. And it slowly opens up like a topic of discussion between the two. Cause then he's like, oh, I never thought about it like that. But then what is this? And what do I need to do? And then honestly, just reiterating steps that you would go through with him, say like through the healthcare, like going through a doctor's visit and wanting him to open up to the doctor. You can definitely just always show him that like the doctor is a good person. They're out there trying to help you. They're listening to you. So if you're really like in pain in your arm or your stomach, definitely tell them. Speak with a loud voice too. He really talks in a really low voice. And so, yeah, just honestly giving them that little push or just kind of trailing them on, just like doing like defining terms, like as I've discussed a little bit. I think that would be a really good way of like just trying to educate them, even though you're kind of weary about like the age range that they're in at the moment. But yeah.
Yeah, that was really good. I was, I think my mom had the talk with me when I was like in second grade. And in Nigerian culture, it's like not a big deal at all. So that's really interesting to hear about that. But I do have siblings and I do have to talk with them because my dad doesn't want to. And I think what has helped the most, I think every kid is different. But I know like for my sister, like she can't take super long talks in any sense at all. So I kind of just like, I actually wrote down on a sticky note like bullet points of like, okay, what is important for her to know in case she misses everything else. And I put that at the beginning. And then not important stuff, or like, I don't want to say not important, but things that can come later, might come later down the line that's what I kind of put towards the end of my little spiel. I think for my little brother, he's also really shy. And so I think Michelle's method is actually like what I try to use with him too, is kind of trying to lead him into like the conversation because he won't have it otherwise. But yeah, that's my like that's my perspective on that.
We also have a question from the mentee. Oh, there's a few questions. The first, where can we find policies around judicial bypass? Does it regard more than abortion in healthcare? So where would you all suggest them finding information about the judicial bypass that you discussed in your presentation?
Well, during our research, we used a resource from Texas Health Steps that we could probably link in the chat. Just give me one moment.
Okay, I'm gonna look at some other questions. Do teens know about or utilize the health educators at clinics and hospitals? How can we raise awareness and get them to go there more? So do you all's peers know about the health educators at clinics and hospitals?
I would think not. I think a lot of my friends only really ever seek medical education whenever it is like they need it, like something is happening and they need it, rather than like a preventative thing. I feel like a great way to raise awareness and get people to go more often would just be like spread the word, like word of mouth, but then also kind of figuring out a way to make it easy for people to go to, so they don't, because I feel like teens, we can always come up with like so many excuses to not like have to like find out more about our health or like deal with our health because there are a million things going on at a time. So maybe find a way to just like take the pressure off of going, maybe have like a resource that will like always be there that someone can like access, and encourage like people to like do it like with their friends or with people that they know.
Do teens want to advocate for health education in schools? Would y'all feel that health education and insurance and housing, taxes, etc., would be better than algebra?
I feel like this is a really good question. I think it would be nice, but I feel like it would be very overwhelming. I feel like there can be another approach in educating adolescents or say teens in the school system better within. I think you're supposed to take health education as a requirement, and honestly, if that course could give some information about this rather than being tested over this information, but just being given this information so that we can like start a discussion, I think that would be really cool, because I'm definitely interested in knowing about insurance, housing, and taxes at the moment. So if I could have that earlier on, that would honestly be great. So yeah.
If you were a parent, what kind of parent would you be? Like, how would you characterize yourselves? And I think they want to hear from everyone.
This is funny. I feel like y'all don't know my mom. My mom is like amazing. So if I'm like a pie slice of my mother, that'd be kind of cool. But I think in terms of maybe this topic, I would want to be as like my mom was really upfront about like a lot of the healthcare stuff. And she was like, obviously as like a black woman, she was like, okay, like if you don't know these things, they're not going to give them to you. So you need to advocate for yourself. And like I want to do that with my kid as well. I think as a parent, education is power, is literal power. So I don't want to overwhelm my kids, obviously, but I also want them to know that like no, I don't want them to feel intimidated if there's like a mass amount of information. I want them to see an opportunity and not to be so intimidated whenever they see like a bunch of different rules and regulations, because that just means they need to understand them so that they can take advantage of those things. I hope that makes sense.
So to answer that question, I think so for I would probably describe myself as like empathetic and open. I think that establishing from the start that like I was once in their shoes and this was an uncomfortable topic as well for me. And just getting that out of the way is a great just to start the discussion. And then as well as just have them lead the conversation, ask them what questions they have, and then from there, you'll build the conversation that way.
I
Yeah.
think for me, oh,
You go ahead. Go ahead.
okay. I was gonna say for me, I would say I would be like a conversational mother. And what I mean by that is that I'm gonna give you an example, but there was a time where I worked with kids, like very, very little kids, like infants. Well, not infants, but toddlers. And they understand so many things. Of course, I'm not gonna give them the talk at that age, but knowing that kids can understand so many things and people don't give them credit, like, oh, it's just something you would never understand. Like, no, like they understand. And when the time comes, like I want them to feel comfortable and also know that I can be comfortable talking to my children in whatever information they need to know. So I think that's how it will be. I hope that's how I will be.
I'm kind of the same. I want to like promote like a lot of dialogue with my kids. I think about this all the time, but as a kid, like my parents would say no to a bunch of things. And I would get so mad at them and be like, oh, whenever I'm a parent, like I'm going to let my kids do whatever they want. And now growing up, I'm like, okay, that might have been for my safety. I get what they were doing. So as a parent, whenever like those instances come up, I just want to be able to like walk my kids through it and like why I'm saying no. um, I don't think they'll always like be, I guess, appreciative of that because I wasn't as a kid, but definitely being empathetic, understanding why they're getting mad at me at that moment because I was that same kid a while ago too.
I think I'm the last one, but I definitely agree with Sarah of how like leaving conversation open with your like child because of my brother being 9 years younger than me. I feel like I have some qualities of a parent already, and I kind of understand what I would want to enforce or try out with my own kids later in the future. But what is it? I always try to make sure that when sometimes he gets upset about things or like he's not feeling well, he only opens up to me about it, which is kind of funny, but because I'm a little strict on him, so I would be definitely a strict parent. But he understands that like when it's time for him to talk to me, or like if he feels anger, if you notice any like emotions that's like really like emphasized on your like child, you definitely want to ask them what's wrong rather than ignore it. The second you see like his brows furrow or anything, you definitely want to say, hey, has today been okay? Did anything happen? Do you want some candy or something? I don't know. I think you lead in the conversation like that, and honestly, they can honestly break out in tears right then and there, saying thank you for asking, and like it's been some hard times, but it just opens that up. Like know that like you can be strict and have rules in the house, but know that like when it does come time to like have a conversation with them and see what they're going through or what education they might need within health, definitely just sit down with them and show them like you love them, show them that you're here for them, and just console them too. So yes, I would be strict, but I would also be loving. So it's a good balance.
One other thing I would add is timing. So if they're just coming back from school and they're exhausted, maybe that's not the best time to bring that up. So choose the right time, choose the right place, and make sure that you're checking in with them to see if they need any breaks or if they want to postpone the conversation.
Wait, I just thought of something. Also something that I think makes a good parent in general. I think we're all talking about communication, but I think like right off the bat, what my mom did, and I'm really thankful for, and I'm definitely gonna do with my kid, is she made sure that like she knew that I trusted her and that she could trust me. So it wasn't just like a like, okay, you child, I need you to do A, B, C, D, E, F, G. It was like, I want you also to be able to trust me with whatever. And there was a like, I don't know how other like people feel about this, but like if my mom had like actually done something to me that I didn't like or I felt like I couldn't trust her anymore, she would like apologize. So it didn't feel so much like I was so much under her that like if I felt hurt in any way, I couldn't go to her. And I think establishing that with your kid, that way that whenever sensitive topics like that do come along, they're a lot more comfortable with you. That's about it for me though.
So we have a few more minutes. We had one more question on the mentee, or two more, I think. I am a family therapist who is also bilingual, and I work with Hispanic and Spanish speaking families. In your perspective, what do you wish you could tell parents about ways to give you the sex talk?
So for me, I don't think I ever got the sex talk. I just remember that when I got my period, my mom told me like what to do and I guess what not to do, but she didn't go in depth or anything. Or if she did, I completely forgot. And maybe that's talking about the way that she handled me growing up. But I would just say, because I think in Hispanic communities, it's very common of like, I don't know, trying to avoid the whole thing or like thinking that the minor shouldn't be doing anything related to sex and like, okay, that could be their parents' beliefs, but at the same time, I think it's better to educate them for them to take better care of themselves before anything that they may not want or that could be harmful for them, like so that we can prevent those things. And so I think it shouldn't be like a huge thing, like it should be something normal, something that there's no like taboo or anything attached to it, like just approaching the conversation, because it's something that we should know. It's only going to be for our benefit. And so yeah, I think I would just tell parents to not be afraid to have that conversation.
I definitely agree that like starting the conversation is important because I remember as a kid, my mom never had that conversation with me. Whenever I got my period, I really only knew like what to do because of my elementary school. The school nurse came in and talked about it. And there was this rumor like in my middle school that as soon as you got your period, you were like able to get pregnant. So I was like, oh my gosh, I'm going to get pregnant now. And I was way too old to be thinking that, but that's actually the type of thing that happens whenever like you don't have someone to address it and to talk about it with. I didn't go to the doctor a lot as a kid. I didn't talk about it with my parents. So just kind of knowing that it might be a little bit uncomfortable, but also talking through those emotions of like, why is this uncomfortable for you? Like, how can we go about this in a way that like you're okay with? Um, and then, yeah, just giving that good information.
Yeah, I would agree. I think that irrespective, I guess, of what you, I don't want to say irrespective because I respect everybody, but I guess what I'm trying to say is that at the end of the day, like, I don't know, like you were once a kid too. Like, you're gonna do whatever you want to do, and that's either gonna be with or without like parental supervision. So making sure that they're educated whenever they're actually old enough to make whatever decision that they want to make, I think is like honestly the best way to go because sooner or later they're going to make a decision, and you want that to be a very educated decision.
I really like this question. I know we only have 2 more minutes, but I would really love to know you all's answers. What do you wish your healthcare provider had done better during your visits with them, especially while you were 12 to 17 years old, and when they ask your parents to leave the room during visits? So we had lots of talks about this as a practice, but I'd love to know, like, what do you all think your healthcare providers could have done better or differently?
I want to say this really fast because I know I talk a lot. Okay. So I think that one, she could have like actually tried to have a conversation with me. She just like basically interrogated me and then brought my dad back into the room. Um, Also, my dad bringing me to the doctors, that in and of itself was kind of strange off the bat. It felt strange to me as a girl. But other than that, so don't just interview the kid, like actually like try to have a conversation, even if it is awkward. Because it's okay if it's awkward, because at this age, we're awkward, right? So that's one. And two, like try to, along with having a conversation, like try to get to know the kid. I know that doctors like might not have all the time in the world, might not have all the energy in the world to do that, but it's really important if you want to be effective in that whole method, because if you just interview the kid, the whole point of one-on-one is that they feel comfortable with you, and if you're interrogating them, they're not comfortable. That's all I've got to say.
I agree with Boomy. I've been in situations where my healthcare provider just kind of like came in, gave me the nitty gritty, and then said, "You're done for the day. You can go out now." And I'm like, "Oh, okay." Like that's nice, but it's just like there isn't like that trust. So like for me, maybe I would say like I was shy, like more shy, if anything. And you were asking me a bunch of questions, like what's going on with me, but you just kept on trying to get to the point. I just don't feel comfortable enough to like share to how much to extent, because I'm like, oh, like you're on a time crunch, like my appointment slot is it's like a time, like what is it, a ticking time bomb. And so I just can't go into details about someone like the symptoms that I might be having. Like if you're asking like, are you coughing, I'm like, yes, and then I just don't go into explanation like I've been coughing for the past 3 days. So yeah, I just wish there could be that conversation, or like yes, relationship building that we could have within that time. I know it's like a time slot that you have, but it's still you needing to build that rapport with your patient. So yeah, that's very important.
Okay, that's all the time that we have. Thank you for your presentation. Thank you everyone for sharing. Here's everyone's emails. If anyone wants to reach out to the presenters. So that's all that we have for you. I believe the next session has already started. Thank you for the great questions, for the participation, and you all did amazing. Yay.
Good job, everyone. Thank you.
Thank y'all for coming. It was a pleasure.
Awesome job.
And are y'all gonna go to other presentations, or do y'all have homework tonight?
I always have homework. I never not have homework, ever. So I will
feel
be doing that. Yes.
Well, we'll be in touch.
Yes.
Good
Feel
job,
free to-
everyone. Also, good job, everyone.
Where do
Bye.
I go?
Yeah.
Where, I'm trying to turn my video on because I look a hot mess and I'm exhausted because I've been on screen all day. But where do we go? I came a little late because I was trying to get something to eat.
I think
in your email, there's a link, or there's a bunch of links. And so the different presentations have links for you to go to.
Oh, every link. Oh, everything has a different. I thought it was only 8 because I came in earlier at 5 and then, okay. All right, I'll figure it out.
Yeah, I think we're in a 10-minute networking break right now with the first link that we all used at the beginning, and then the next talk will start in this same link. Looks like that will start at 6:50. So we have a few more.
Oh, so it goes back. It just goes back and forth.
So you can, yeah. So this talk.
And there's
another one.
And there's a choice between 2 talks, so make sure you choose one.
Yeah. So
how are you?
Hi, I'm good. How are you? Were you here
guys
for the?
spoke.
Were you here for our talk?
Yes, I missed the first bit of it, but yeah.
We have it recorded, so no worries.
Oh, good. Then I'll go back and listen to the beginning. Thank y'all, though. I appreciate it.